My particular area of responsibility is in the children's echocardiography service. This includes ensuring that children who have scans in the operating theatre have an effective and accurate scan to ensure that the operation that they've had has been successful. We are now performing almost 500 operations per year, and that to be physically present for all 500, even amongst a group, is very challenging. There is one consultant who's on service for our inpatients, and if they were called from theatres, they would have to go scrub, get changed, and go to theatres to be able to directly review the images. In our centre, that will take around about 90 minutes, sometimes up to a couple of hours, depending on how long they would have to remain in theatre until they were happy.
We engaged as a small team to look at the best way to deliver remote view of the echocardiograms from the ultrasound machine. So the Polycom group series, and we installed a group 500 on the back of the ultrasound machine because the image resolution, which was ideal for our cardiologists.
The on-service consultant can now go to one of several review stations, and they can, within a couple of minutes, be talking to the operators and effectively reduce that time down to 4 or 5 minute review of the images concerned. This scan's been obtained by the surgeon placing the ultrasound probe directly onto the heart, what's called an epicardial scan. So this is a patient who has had a hole within the heart which has been surgically closed, and I'm very happy that this hole has been effectively closed without the need for me to go to the operating theatre and to do the scan myself. The facility to talk live to the operator means that we are able to discuss patients much more readily, much faster than we would otherwise be doing.
One of the big things from my point of view is the high quality we can get in the imaging that's transmitted from theatre to the viewing room, and the ability to do these, to perform these transactions remotely rather than going to theatre makes it much easier for us to have a much more efficient day.
I think the system is also proving very cost effective in that we have introduced something which has avoided having to employ potentially a lot of extra staff, and that we're able to use our existing staff better. So we think it's a more rapid and better service for the patients who are undergoing surgery.